Hey everyone, this is Dr. Gerald Ferenz with Performance RX Sports Care. So today I'm going to go over how to foam roll your lower back for low back pain. So we're going to start out on the floor, and you should have a foam roller of your own. I typically like trigger point therapy, or my friend has one called M80 roller, and I'll put that in the link below. A hollowed out one tends to be more durable over time, but if you have really severe low back pain, I would suggest buying one at a local sporting goods store that is relatively soft, and there's different grades of foam rollers that you can use. So again, we're going to start out on the floor. We'll have our knees up by our chest, and we're going to place the foam roller parallel to our lower back. And we're going to use our hands to support ourselves as we lower ourselves down. You're going to slowly roll your hips down towards your feet. And so this is the starting position. This is a general movement. I don't really suggest doing it because it puts more shear forces on your lumbar spine and the discs. So rather, if you have pain to one side or the other, so let's just say I have pain on my left side, you're going to tilt slightly over to that side, and you're going to foam roll back and forth like that. So you should take 1 to 5, maybe 10 seconds to go up and down through the lumbar spine. And once you find a sensitive area, so let's just say I have a sensitive trigger point right here, you're going to oscillate back and forth on that trigger point. So maybe 1 to 3 centimeters, so about 1.5 inches to an inch. And if you like, you can stop and hold it on that trigger point, and you can incorporate some movement with your feet. So what happens is, with the lower back muscles, they're the first ones to activate with any type of movement, so they are the stabilizer muscles for the spine. So when you move your feet, they activate and relax during movement. So when you're moving, they're activating to stabilize the spine. And when you relax, the muscles also relax. So once you find that trigger point, you can go ahead and do that. So another thing you can do, other than moving your foot down and straightening it and then bringing it back up, is, again, supporting with your elbow. You can bring the knee to the chest. It does create some lumbar flexion, so low back flexion. We don't want to do that too much because it may continue to hurt your back. So you bring it towards your chest just to the point of pain, and then bring it back down. And you can even rock back and forth or side to side with your low back. That way you're able to get different angles on that trigger point that you're feeling. Most low back injuries occur around the L4, L5, L5S1 region, so in which case you want to move that foam roller closer towards the hips. And once you get in towards the hips, you'll find that it's a little difficult to get to that lower back musculature because you have your iliums or your SI joints that are kind of in the way. So this wide foam roller doesn't really allow you to get that pinpoint accuracy that you would like. So what we'll do is we'll go over how to foam roll your back with a tennis ball next. This time we're going to talk about how to foam roll your lower back with a tennis ball. So in certain areas of the low back, there's difficulty getting to those trigger points that cause low back pain because of the iliac crest or the SI joint being in the way of the lumbar muscles. So when you have a big long foam roller, it tends to be a broad, almost massage-like treatment. So you want to get that trigger point type treatment with, like someone's giving you a massage with their thumbs. So the best way to do that is either with a tennis ball or with a lacrosse ball if you can handle that kind of intensity. And even more intense so would be a golf ball. But sometimes, because of people's lower backs, they may not even be able to get good pressure onto that lower back musculature. So we're going to take our tennis ball, and we're actually going to lie on our back first. We're going to have our knees bent close to the hips. And you're going to pick a side, whichever side you feel is the most tolerable to take the pressure. You'll probably want to start on the side that has the least amount of pain. And so you're going to find your SI joint. So here's my SI joint. And you're going to come just to the midline of that, right off the, so here's the spine, here's my SI joint, and you're going to come right in between. And that's where we will place our tennis ball. And so you're just going to lie right on it, and you're going to kind of use your legs to help walk you forward. And then you can also push back. And you'll notice that you'll find a tender area, and when you find a tender area, you can just oscillate your hips back and forth a couple times. You only want to go about 1 to 3 centimeters, so about an inch, inch and a half of distance. I tend to just find that trigger point, fall right off of it, and then come back on, and then fall right off of it in the other direction. And if you like, you can stay on that trigger point and hold it for about 30 seconds. And once you do that, you may notice that you start to feel some relief. And even in this position where you're holding it, you can incorporate some leg movement to help move those muscular structures over that tennis ball. So when we move our legs, or any limb for that matter, the muscles in our lower back activate to help stabilize our core. So they're the first muscles to activate in any type of movement. So we're going to straighten out our leg slowly and stop, and you can stop right there for a few seconds or 30 seconds, it's up to you. And then we're going to bring it back. You can even elevate the foot off of the floor, bringing the knee to the chest, and you don't want to bring it all the way to the chest because 1, the tennis ball might slide out, 2, our lumbar spine will start to flex a little bit too much, and we don't want too much flexion, especially if we're in pain. So you're just going to elevate the leg until you feel the spine come out of neutral, and then you're going to lower it back down. And you can do that with both legs. So just because you feel it more so on one side than the other doesn't mean that the muscles on the side you're treating aren't being activated. There's a firing pattern with the low back muscles. Usually it's whatever limb you're moving, the opposite side fires first, and then the same side fires next. It's milliseconds, but there's a difference. So you can move both legs when you're applying the trigger point pressure with the tennis ball.